Oop. Sorry, guys. So good. Thank you. Said no sound. It was a button I just didn't click. So welcome. So to the next edition to Ask Me Anything. Just saying thank you for joining me an hour earlier. I have some plans later tonight that I wasn't going to be able to be here at 6 p.m. Central Time, but next Monday will be. I'll answer the questions that have been submitted ahead of time and get to your questions in the comments. So, yeah, you can see the Yeti microphone. Yeah, there's always a little button on it. If you click on it, it sometimes puts it into mute mode. So the first question tonight was, what exactly is creatine? What are the pros and cons of supplementing with it? So creatine can be used to help with mitochondrial support, to make more energy. A lot of bodybuilders take it to help with muscle mass. The cons, if you do it wrong, you potentially could trigger a episode of shingles from personal experience. So generally do not want to load with it if you're taking it. This is normally 5 grams a day, but this is not direct medical advice. So this is all educational. So if you're interested in any particular supplement, you need to talk to your own doctors about what else you're taking, supplement and medication. Make sure there's not any interactions with it. Next question up tonight. What exactly is a lipase? Lipases are just enzymes that break down generally fats. Is nattokinase a lipase? Not that I know of. Nattokinase is a fibrinolytic enzyme, and pros and cons of nattokinase is mostly if you have elevated fibrinogen levels and need your fibrinogen levels to be lower. Fibrinogen is a marker of how sticky the blood is, how likely is the blood to clot. Nattokinase can potentially help with that. Question up, which would reduce risk most? 4 or 5 days of resistance training or 4 or 5 days of red infrared therapy? Depends on what you mean by reduce risk most. I would, let's say, hazard a guess, let's say health span and longevity. Let's go for the resistance training, because the more muscle you can hold on to as you age, the better you're going to tend to do. Now, if you have an injury, then the red and infrared light therapy is potentially going to be more beneficial. So I always talk about the light therapy panels as being supplements. They supplement your normal light environments. So they can help with mitochondrial support, lower inflammation, increase blood flow, decrease pain. So both are useful, but if you had to pick between the two, I would pick resistance training. But the answer really is both. Question up about blood pressure. So, as a bodybuilder, why might their diastolic blood pressure run lower in the 50s to 60s, but their systolic 120 to 130s? It's going to depend a little bit. One, do you have any aortic valve disease? If you have significant aortic regurgitation, this wide pulse pressure, that would be my concern. I'm not saying necessarily that you do, but I have definitely seen some bodybuilders with dilated aortas with aortic regurgitation, and this is the reason that they have lower diastolic pressures. Second thing that always would be concerning is, do you actually have an accurate cuff for the size of your arm? If they're using a normal person cuff, you're often going to get some misreadings on it, so you want to make sure that the cuff is actually measured out for the size of your Hulk Hogan biceps, if that's what you're shooting for. And then the other thing is, is this a trend? Is it, every day shortly after exercising, or is this all day long? So sometimes in this case, we'll do a 24-hour blood pressure monitor to see where your diastolic pressures are while you're sleeping as well. So we tend to use the BioBeat device to do that because it's non-invasive. It's a chest patch that uses photoplasmography to measure your blood pressure every 15 minutes. So you can't really fake that blood pressure too well. So person's asking about a copy of the ApoE4 allele. Will this make them have an increased risk of heart disease? The answer is potentially, because it does tend to affect lipoprotein metabolism. It can increase the risk of insulin resistance and diabetes, which can then damage the glycocalyx of the arteries, which then can lead to heart disease. So it's potential, but how you live your life determines if that gene is really going to be causing a lot of oxidative stress and inflammation. So potential, but not guaranteed risk. Same with it is, people, I often get that question is, if I have an ApoE4 allele, am I at higher risk of Alzheimer's? The answer is yes, you're at higher risk, but that does not necessarily mean you're going to go on to become Alzheimer affected by Alzheimer's, let's say. You have a lot of things you can do to turn genes on or off. Questions about wrist blood pressure monitors. Are they reliable? As a general, no, but I have seen some that are not bad. Some of the Omron cuffs can work on occasion. I have a particular one that I got from Europe that can do nocturnal blood pressures. That seems to be pretty well calibrated compared to my bicep Omron Evolve cuff, and then also my Mercury cuffs and my Accor device in my office. So possibly, but most wrist cuffs are highly inaccurate. But the best way to know is it accurate for you is if you already have the cuff, take it into your doctor's office, have them monitor it with whatever device that they're using, and see how close your home monitor is to the one that you're getting in the office. Ideally, it would be a Mercury column that they're measuring it against. That's the gold standard. Not a lot of those still out there. It actually took me a little bit of time to find some of these because they don't hardly sell them anymore. But that's the best way to know, is your wrist cuff actually accurate. Now, there are companies working on wrist straps that can actually measure the blood pressure from the photoplasmography. Those I've seen are okay. I have a watch that actually has an air bladder that then takes it off your radial pulse. Decent, but it's one of the cases where it's not reliable enough yet that I would say I'd make clinical decisions off of it. Now, if it rhymes and it's high, then I'd make somebody do it on a bicep cuff and it's still high, then we'd make medical treatment options based off it. But some of the wrist ones, especially watches, that's very interesting. It'll be pretty soon you'll just be able to do 24-hour blood pressure monitors at home easily every day, let's say. Question up: can clogged arteries be cleared naturally? I don't quite know exactly what you mean by naturally. If you mean without any supplements or medications, very unlikely. So now, does it have to be high-dose medications? No. It depends on what's driving the clogging, as you're calling it. It starts with endothelial dysfunction. It starts with the glycocalyx of the arteries being impaired. The glycocalyx is your largest organ. It lines your 60,000 miles of blood vessels. It's a protective gel coating. If that coating gets damaged, that is the setup that the endothelium underneath it gets damaged. Then the intima gets damaged. Then you get the immune system activated. Then you start developing plaque. So you got to figure out what's damaging the glycocalyx. Is it obesity, smoking, infection, heavy metals, plastics, lack of exercise, sleep apnea, oxidized LDL, heavy metals? Hundreds of things can damage the glycocalyx, and you have to go looking for them and withdraw those. So remove the things that are causing the damage, and then the body has a pretty amazing ability to repair itself if the damage stops progressing. But the three big buckets, and there's more, but the three biggest buckets, what are your nitric oxide levels? Do you have healthy blood pressure? Do you have elastic arteries? There's other tests that you can look at: pulse wave velocity, endoPET scans. Those generally need to go to the office, such as mine at Apollo Cardiology, where we have those kind of devices. Second, what are your oxidative stress and inflammation markers? That's lab work. Often I use Boston Heart Lab or Cleveland Heart Lab to look at those. And then the third one is your lipoproteins. Now, not every LDL particle is the same, but in general, lower particle count tend to have less risk. So where is your ApoB and your LDL particle? That'll give you an idea if you have an ability to have your plaque stabilize and potentially reverse. All right. Good questions tonight. I think there's a couple more popping up here. So switching up to some quantum questions. So what are my favorite heart health and circadian rhythm books? So my favorite circadian rhythm book would be still Dr. Panda's book, Dr. Sachin Panda. It's called The Circadian Code. It's the best starter book on circadian rhythms that I've seen so far. So Dr. Panda is the good one to start with. Carrie Bennett, she's on Instagram as Carrie B Wellness. She has a wealth of information in her feed. She often recommends different books there. So I would look at Carrie B Wellness. And then favorite heart health books. One of my mentors, Dr. Mark Houston, has a couple. What your doctor won't tell you about heart disease and what your doctor won't tell you about hypertension are two ones I keep on my shelf at the office to show people. Dr. Khan has a good one as well. I think it's dead execs don't get bonuses. Goes a lot through the testing, like calcium scores, testing that looks at nitric oxide levels, a lot of things that we do in our office, Dr. Khan also does at his practice. So those are probably the starting books I'd recommend people consider. So anything from Dr. Khan or Dr. Mark Houston. And I'll probably get the question, when am I going to write my book? That's a back burner thing. By the time I probably get my ideas on paper, everything's going to change so quickly. So I would only probably do a tactical guide because by the time I do anything very scientific, everything's going to switch up. So, but I'm thinking about it. But it'd probably be more directed, honestly, towards kids because we got to get a hold of them before they're 18 so they have good, healthy lifestyle habits built in so they don't end up seeing my cardiology colleagues in their 40s and 50s. All right, good question. So genetic diseases don't always get expressed. Any ways to avoid FH mutation doing so? FH stands for familial hyperlipidemia. It often indicates that patients will have very high lipoproteins when they do testing. There's people who have heterozygous mutations and people who have homozygous mutations. If you have heterozygous, your lipids are high, but not sky high, since, like 600 LDLs. But like people who have homozygous, those people can have heart attacks, when they're still children. So most people with FH or heterozygous have one abnormal copy. But if you do the things that help protect nitric oxide levels, keep your glycocalyx healthy, stay metabolically healthy with low oxidative stress and inflammation, just having high lipids is not going to always drive you to have plaque in your arteries. I'll be talking about this tomorrow. The lean mass hyperresponders had a presentation a couple of months ago. Dr. Budov had talked about these studies that were looking at patients who had FH, who had calcium scores of 0, and did not have increased cardiovascular events. But if you have familial hyperlipidemia and you have a positive calcium score, you have like a threefold risk of having a heart attack or stroke. So the best thing is get a calcium score test and see where your scores are at. But there's nothing that I know from my standpoint that you could eat, exercise, manage your stress, or sleep to absolutely turn off one of the FH genes. Those are just going to help the other things that tend to cause the lipoproteins from oxidizing in the first place. They're all very important, but you're not going to necessarily turn off the FH genes. All right, so again, this is not going to be directed medical advice, but somebody's saying they have a question about having increased heart rates with mild exertion after having the COVID-19 virus. They report to have a normal baseline EKG. This is not an uncommon finding. The spike proteins can damage the endothelial glycocalyx. The microcirculation then doesn't have the capacity to deliver oxygen nutrients to the tissues, and people tend to have more increases of dyspnea, which is shortness of breath, palpitations, and blood pressure increases. It's an endothelial dysfunction, I should say. So how to improve that? Well, best probably to get some blood work with a doctor who knows how to improve your nitric oxide levels and improve the endothelial glycocalyx. You can also consider wearing a Holter monitor to actually see what your 24-hour blood pressure, your 24-hour heart rates would be and where you're really having these spikes at. Where and how is, they wrote nitrogen oxide produced, probably meaning nitric, N-I-T-R-I-C oxide produced. And does it help in removing plaque and calcifications? You would not actually want to remove calcifications. You would want plaque to shrink or delipidate if possible. Calcifications are stabilizing factors. But back to the first part of the question, where and how is nitric oxide produced? There's multiple types of nitric oxide, but most of the time when I'm getting this question, they're asking about the endothelial types of nitric oxide. There's also the inducible nitric oxide, which helps your immune system fight infections. There's neuronal nitric oxide in the brain and used to basically send messages between neurons. But most of the time people are asking the cardiologist about endothelial nitric oxide synthase. That's produced right on the lining of the arteries, on the endothelium. So your arteries have a one-cell thick layer called the endothelium. The glycocalyx is a protective gel coat that's on top of the endothelium. Think of taking a fish out of water and it's slimy. That's what the glycocalyx is. When blood flow goes across the glycocalyx, such as when you're exercising, that transduces a message to the endothelium that blood is traveling fast. The underlying endothelium releases nitric oxide. It does that by converting arginine in the presence of oxygen and the enzyme endothelial nitric oxide synthase into citrulline and nitric oxide. But after the age of 40, that process doesn't work as well as the endothelial nitric oxide synthase enzyme tends to slow down. So there is an endosalivary pathway. So when we eat foods rich in nitrates, which is mostly dark green leafy vegetables and beets, if you have nitrate-reducing bacteria in your saliva, that will break it down into nitrites. You will swallow that, and as long as you have stomach acid, it's a process, but eventually nitric oxide will get produced. So you don't want to be disrupting your oral microbiome with antiseptic mouthwash or antimicrobial mouthwashes. You want to avoid fluoride because it disrupts the oral microbiome. Then you really want to try to avoid being on any type of stomach acid blocking medications unless you've had recent peptic ulcer disease, H. pylori infection, or under the care of a doctor who understands why you need to be on this more than the 6 weeks that they've ever been approved to be on. But if you have to be on acid blocking medicine, you often will have lower nitric oxide levels. It may need to do stuff to improve those levels. The things that can also produce it, other than exercise, it's being outside in the sun, getting UVA wavelengths of light to strike your skin will liberate nitric oxide. Photobiomodulation also can help in ways. Does it help remove plaque? Yes. It also helps prevent plaque from building up in the first place. Nitric oxide prevents the lipoproteins from sticking to the arteries. It repels them from sticking to the arteries. So nitric oxide is critical to having healthy arteries. And question, how can circadian rhythms help with heart health, especially managing FH and high cholesterol? Probably not much with the lipid standpoint, but heart health, the body is always seeking to figure out, is it daytime or nighttime based off of the signals, mainly light signals hitting the back of your eyes and the timing that your nutrients come in. Your blood pressure has a circadian rhythm. Your blood pressure generally drops 10 to 15% while you sleep. This is why we often will recommend 24-hour blood pressure monitors to people to make sure that it actually does dip appropriately. Because if it does not, then that person's at an increased risk of stroke or heart attack. So blood pressure normally increases between 3 a.m. and 5 a.m. as cortisol levels start to rise. And then there's definitely some circadian rhythms also on heart rate. Exercise times, optimally, is generally going to be in the afternoon. That's when your body's more primed to do it. And you want to be trying to stay in kind of a balance where you're going to be able to sleep well, so you don't want to be exercising too close to bedtime. So yes, there is some roles of circadian rhythms in the heart itself, but think about it as more as it's the whole systems. It's not just the heart. All right. So I got through all the pre-submitted questions. Thank you guys. I see a couple popping up in the comments. Questions about red light therapy devices from an EMF standpoint that emit EMFs. Yes, that is definitely a potential risk for some of the devices. It's a test, don't guess type of philosophy. So ideally you would have an EMF meter to be able to test any devices that you're using at home, but you have to use the inverse square law. The further you're away from the device, the amount of non-native EMF drops. It's mostly a marketing metric where they tell you to be at least 6 inches away from their devices. Because it's the fans that are in the devices cooling the lights off that are emitting the EMFs with the spinning fan blades. But is it enough to not want to use the device? No, but you just need to know who you're working with. So you want to work with a reputable company. Ideally, they'd have third-party analysis of the devices, because you want to know not only the EMFs, but you want to know, what is the radiance of the device? Are the wavelengths actually truly the ones that are being emitted? So EMF, it is something to be interested in, but not enough to not use it. Now, if you have a battery-powered device, that's DC electric power, you're going to have those devices up and on your body. So that's probably going to be the future, is that, these panels will probably, be like stage 1 of photomodulation. Everything in the future is probably going to be contact-based, because then you decrease so much of the scattering of the light. So this is probably a question that's, let's say you got a time limit on, but it's back to the test, don't guess. If you're concerned about EMFs, you have to learn how to use the meters or hire somebody who can use the meters for you. All right, so good question. Somebody's asking, is it worth repeating a CT coronary calcium score if it was last done 5 years ago? Is it expected to go up? Their last score was 90 and they've been on a stand for 25 years. So the best way to think about a calcium score test is that the goal is to have a score of 0 for as long as possible. Now, I've still seen people in their 80s have scores of 0, but I've also seen people in their mid-30s have very high scores. High score is basically anything over 400, and over 1,000 is very high risk. So a score of 90, it sort of depends on how old you are when it was popped 90. That being said, once it's above 0, it's not super useful to repeat the scan because calcium is a stabilizing function of plaque. You really want to know how much soft plaque is still present. And the calcium score test does not, assess that by design. So if you really want to know is the plaque stable, you have to do a CT coronary angiogram. That requires a IV with contrast, so you need to have normal kidneys and not be allergic to contrast. And then, depending on, the sensitivity of the reader, you may or may not want to have the images then sent on to one of the companies that can do AI interpretations of the images to tell you how much soft plaque is present versus how much hard plaque. You had mentioned being on a stand for long periods of time. Statins can help stabilize the plaques, but one of the things that it does is it often calcifies the plaques. So people think maybe they're getting worse when their calcium score is going up on a statin. That's probably not the case. It's probably more that the statin's taking the soft, more inflamed plaques, decreasing the inflammation, and stabilizing the plaque by calcifying it, and the calcium scores go back up. So most time I do not repeat the calcium scores once they're over 0. If your score is 0, generally, every 3 to 5 years, you would repeat a calcium score test to ensure that it's still 0. And then I'll take one more question. It's going to be a little bit of a broad answer because there's a lot of reasons, but what are causes for leaky valves? I would assume you mean cardiac valves. You have a mitral, tricuspid, pulmonic, and aortic valve. Some congenital abnormalities, instead of having 3 leaflets, they have 2 leaflets. There can be infectious, so endocarditis is an often common cause of it. I talked earlier about somebody having low diastolic pressure. Sometimes that's due to aortic root dilation, stretching the aortic valve out, and then the valve can't coapt, and the valve leaks, but the valve hasn't been destroyed. It's just stretching out the annulus. There are some autoimmune conditions that can worsen valve disease. There's myxomatous valve disease, mitral valve prolapse. Sometimes there's a little bit of a genetic predisposition to that. But those are kind of the most common reasons why people have, quote, leaky valves. So, well, I appreciate your guys' time and attention today. Thank you again for coming up an hour earlier. Have some early dinner plans tonight. Wasn't going to be able to jump on here at 6 p.m. Central Time, but I will be back here next Monday going over it. Tomorrow, have a big day. I'll post some of the pictures in my stories, but it's going to be very enlightening tomorrow. We're talking a lot about how to test your arterial health, looking at endothelial health. We'll be talking about nitric oxide optimization, blood pressure optimization, talk about lipoproteins, lean mass hyperresponders, the recent study that talked about microplastics affecting the carotid arteries. So if you're interested in that, follow my stories tomorrow. So hope you guys have a good night, and we'll see you next time.